Welcome back to the latest episode of Cracking the Code with Chris Bowen. So Chris Bowen is the founder and CISO of ClearDATA, the leading managed cloud and defense provider for healthcare organizations. And Chris, in today's episode, we want to discuss the latest cybersecurity policy. So on the last episode, we were talking about how the White House made some very public, very strong statements about preparing to tackle cybersecurity initiatives. And then not too long after the episode, Senator Warner from Virginia released a new policy paper titled Cybersecurity is Patient Safety. And I'm curious if you can walk us through your take on his views on cybersecurity, especially for healthcare organizations, and what this means for the industry as a whole.
Yeah, this was a fun one, Ryan. We were at the Health Sector Cyber Council Working Group annual all hands or semi-annual all hands meeting in Washington. And Senator Warner's staff came in and briefed us on what was in this policy paper. And if you haven't read it, we'll provide a link to you in the video here, but you can go download that and take a look at it. But the policy paper was released at 6 a.m. on a Wednesday morning, and by 8 a.m. his staff was briefing us. And it was really kind of fun. It was interesting to pick the brains of the staff members who wrote the paper. There's really a couple of different ideas and categories, if you will. One of those is really we need to improve our leadership, our national risk posture. What is our risk tolerance? And are there some minimum standards that we need to think about when it comes to securing our healthcare critical infrastructure? So the paper talks a little bit about that. It talks about modernizing HIPAA to accommodate or to better deal with some of the emerging threats that we see, for example, ransomware. It addresses things like the Stark laws and how a covered entity can receive and maybe expand the receiving of cybersecurity services that are donated, and how to clarify some of that. So it seeks some ideas from the industry itself. There were some really innovative things about this as well. One was, based on some of the shortages of cybersecurity talent, how do we incent people to become experts at cybersecurity? Students, for example. Could we forgive the student loans for students who've majored in a specific program related to cybersecurity? Could we forgive loans for those who go work in the rural areas in a cybersecurity manner? A lot of the critical access hospitals that you see out in the country have a great big lack of talent, and it's hard for them to attract folks who can help secure the patient records. So all kinds of great thoughts have been put into this policy option paper. It's really designed to elicit feedback and some ideas around policy for specifically healthcare and cybersecurity. There are other ideas that he proposes, which is establishing a bill of materials. What is in a specific piece of software that is going to be deployed in a healthcare setting, for example? How do we better share information? How do we better share threat information? And when a hospital system is undergoing an attack, how do we use that information to potentially save others from having the same challenges? There's a lot to this paper. It's about 36 pages long. It's great to take a look at and read, and I highly recommend that you do that and provide your own comments and provide your own input into some of these requests.
Absolutely. And just to push a little bit deeper and potentially put you on the spot to try to rank or prioritize these things, you're right. He mentioned a few different initiatives. So one was potentially federal disaster relief funds for victims of cybersecurity, student loan forgiveness for new professionals that provide healthcare cybersecurity services in rural areas. And then finally, he calls for increased industry partnerships with the federal government. And we've heard more about, growing industry partnerships with the federal government. But, if you had to prioritize these, like if you had to place them on an order of importance and which one should we tackle first, out of those three initiatives, what do you think has the highest ROI to protect the industry as a whole?
That's a really good question, and yes, you did put me on the spot, Ryan. That's I got to think on my feet now here. So I think one of the most impactful things we could do is prepare a workforce that can rise to the challenge of combating some of these attacks and understanding the operational hygiene that it takes, specifically in healthcare, to uh, thwart these attacks, to prevent them from happening in the first place, if you will. So I think the training and the workforce development is super important. I also think that understanding what goes into the software will allow us to better defend against vulnerabilities within that software. Um, there are other areas within this paper that I'd really like to call out, including a priority that I think is long overdue. If you think about Europe and you think about other countries that have adopted certain privacy rules, one of the things about healthcare is that it only, or HIPAA rather, is that it only applies to what they call covered entities and the business associates. Those include providers, the payers, folks who are in the operations of healthcare. But I can still uh, use my smartwatch here and collect a lot of health data that's the same stuff that my doctor gets. And none of that is covered by the HIPAA privacy rule or the HIPAA security rule. Lots of different applications are collecting health data that have zero accountability from a privacy perspective. And so you're seeing uh, uh, menstrual cycle trackers, you're seeing heart rate monitors on your wristwatch, you're seeing all kinds of different uh, information being shared at a pharmacy, for example, or at a drugstore when you're buying certain medication, even just your location data that Google and other cloud providers love to track uh, can actually lead to a profile. So I think part of this paper addresses some of that. But in terms of what's the most uh, incredibly effective ROI on this, I think having some minimum standards would be one of those that I would highly recommend. You can't really secure something if you're just kind of willy-nilly an approach to cybersecurity. I do think we need to get serious about some kind of a framework that the healthcare sector has to adopt.
Yeah, and I think we're finally seeing increased like mainstream coverage on these topics. It seemed like, maybe 3 or 4 years ago, for a lot of folks, cybersecurity was kind of an abstract topic. It was maybe something that, a lot of folks who are non-technical kind of wrote off or didn't really think about when they were, interacting online or using data. But, we're seeing a lot more mainstream coverage about the real world impacts when cybersecurity is not up to snuff. NBC recently released an article about how, a young boy went in for a pretty routine tonsil procedure. And the health system was currently, I think they were undergoing either ransomware or denial of service attack from a cyber criminal. And the machine that measures out his medicine was not working. He ended up receiving more than 5 times the actual dose that he should have taken. He experienced an overdose in the hospital, very scary stuff that he ended up living through. But we're just seeing like a much more tangible, real world impact for how critical these things are. And that's a reality that's always motivated the team here at ClearDATA, that data is life. And I'm curious to hear your thoughts on the fact that more news outlets are picking up on this stuff, as well as how that will affect, the policy that the senator is proposing.
Yeah, this particular system, Common Spirit, yeah, they went. They're still undergoing the fallout from a ransomware attack. That's what caused this issue, and it was widespread. It was. We'll share the article in the video if you'd like to read it, but it gives kind of a broad view of what's unfolding right now in that system. The child that was suffered the overdose potentially could have died. It was an opioid overdose based on what you just described. And what a cute kid! If you look at that article, the parent of that child was open enough to let us put a face to that victimhood, if you will. Um, I've long argued that a ransomware attack is the same as criminals trying to kill people. Literally, when you have a diversion of an ambulance, when you have what happened to this poor child in this hospital system, um, when you don't have the full view of the patient's record or the patient's information that they need to have for a surgery, for example, people die. They literally die. And a lot of studies haven't necessarily emerged yet. I know the New England Journal of Medicine has done a study on this. I know that the Poneman Institute has done some research on the effects of ransomware as well. But you're absolutely right. It's infuriating to me that we continue to see ransomware attacks in the healthcare sector. And I applaud Senator Warner for coming to the table and saying, let's try to figure out a way to solve this. And I sure hope the healthcare industry rises up and provides some really great ideas, because I think it's time. I think it's long past overdue in terms of us getting together and fixing this. We're just way too behind to not do anything about it.
Exactly, exactly. And again, I want to press you on a recent comment that you made in healthcare IT news. So you had the opportunity to comment on Senator Warner's policy paper and the proposal. And, in your words, you said, we've set up our health system to fail in these circumstances, where if a healthcare provider gets attacked by ransomware, they suffer reputational harm, their operations falter, trial lawyers build class action lawsuits against them, and then after all that is done, regulators come in to punish them. And it almost seems like we painted them into a corner with having to fend for themselves as they're facing increasingly sophisticated either nation state actors or collectives of cyber criminals. So I'd be curious to get your thoughts on how we can change this cycle or this structure so that we can really enable healthcare providers to succeed instead of seemingly cutting their knees out from underneath them, in a sense.
I mean, you said that perfectly, Ryan. I feel strongly about the fact that a private entity that sits in North Dakota somewhere has to rise up and fight a nation state, a China, a Russia, a North Korea, any kind of an actor that is associated with one of these governments, or you name the country, they're all over the place. But it's incredible to me that the private sector has to fight that day in and day out. I think it's the federal government's job to help defend the critical infrastructure. That doesn't mean go out and punish them after the fact, punish the entity after the fact. It means preventing this from happening in the first place. And so I do think the federal government has a role here, because you're seeing acts of war on the American people. And without, one of the primary roles of government is to protect the population, the civilians, the population of the United States. And then if you take that even further and think about healthcare patients, it's crazy to think that we're not already stepping up and doing that. I've seen Europol jump into the fray a lot earlier than we have. I don't see the urgency that I've seen other countries have as it relates to some of the cyber crimes. And it's mostly been around the finances. It's less about the patient safety that I've seen, where our governments have jumped in. It's less about the human life element. It's more about the finances. Yeah, we've seen the FBI go after Bitcoin, but I'd like to see them take out the bad guys and make an example of them and prevent attacks like the ones we saw with Common Spirit happen in the first place. So we have a lot more to do. I mean, it's an edgy comment that I just made there, but I feel strongly that the federal government needs to step up and help stop some of this mayhem from continuing to occur.
Absolutely. Absolutely. No, we have a lot of work to do as an industry, and, hopefully Senator Warner's policy paper and the coverage that we're seeing, hopefully that will generate a lot of impact and a lot of movement. And, I'd be curious to get your closing thoughts as we round out this episode.
Well, the federal government was created, the three branches of government was created to make it a slow process. I think we need to work together, continue to work together with industry leaders, with uh, key partners in the federal government to really focus on coming up with some ideas that Senator Warner has graciously said, let's come up with some ideas about, and let's figure out this whole insurance thing, for example. Let's figure out why it costs so much to protect yourself from, some kind of an attack. Let's figure out how to train the workforce. A lot of these ideas, I applaud Senator Warner and his staff for putting these together, and I just hope that the industry responds by providing some great ideas. We have some that we're going to be providing. We're going to be sharing those with Senator Warner's office, and so watch for more information on that. And we'll maybe share that in one of our next episodes.
Absolutely. Absolutely. Much more to come there. And we appreciate everyone tuning into this episode as always. So thank you for your time, sir. And we'll be back soon.
Thanks a lot, Ryan.